దేశంలోని 174 జిల్లాల్లో డెల్టా ప్లస్ వేరియంట్ గుర్తించినట్లు చెప్పారు ICMR డైరెక్టర్ జనరల్ బల్రామ్ భార్గవ. ప్రస్తుతం ఆయన మీడియాతో మాట్లాడుతున్నారు. లైవ్ చూద్దాం.
One patient here or two patients here or 7 here, so it is very localized, and this virus has also been isolated and has been cultured now, and we are doing the same test that we have done for alpha, beta, gamma and delta, looking at the laboratory test to check the vaccine effect. And this is ongoing, and we should have this results in about 7 to 10 days time, whether the vaccine is working against the Delta plus. This will be first results in the world. It's not available yet anywhere. So I said 49 cases from 10 states, and public health intervention are cluster containment, and that has to be done. Isolation and treatment of cases, quarantine, and ramp up of the vaccination. So wherever you find a cluster, so if you have found 1 case or 8 cases or 9 cases, so there you have to contain it and isolate those people, look at their contacts, and also do the vaccination of the vulnerable people. Now this is another slide which is talking about how the viruses have been cultured. If you can look at the first this is clearly showing India was the 5th country to culture the SARS-CoV-2 virus, and that was in March of 2020. India was the first country in January of 2021 to culture the alpha virus or the UK virus, and then we studied the vaccine. Then in February we cultured this, and in April and in June we have been able to culture even the Delta and the Delta plus, and this is all in peer-reviewed scientific publications, which is and it is available in the public domain. So what happens with the neutralization variants for vaccine? I've earlier mentioned the global literature. Now I'm talking about what is the Indian literature, where we have found the efficacy of against this the alpha, beta, and the delta is very much there with Covaxin, and this is well demonstrated and is published in these journals that are there. So I think this is my last slide, and I won't hang on. The way forward is that public health prevention strategies do not change with variants. However, the COVID appropriate behavior and vaccination has to continue, so that has to continue. But continuous monitoring of these mutations is important to track whether the vaccines that we are using are effective, and whether this new variant that is coming is more transmissible, and is it causing more severe disease which may require hospitalization. So this is why continuous monitoring is essential. And more important, the next step beyond this is that if need be, the vaccine composition can be changed as per the circulating variants of interest and the variants of concern. So that can also be done very easily, more so easily with the RNA vaccines, but can also be done with the whole virion vaccine, and other the adenovirus-based vaccine can also be modified. So friends, I just want to say one last point, that the second wave is not yet over in our country. We have still got 75 districts which have more than 10% prevalence. We have 92 districts which are between 5 and 10% prevalence. And as Love has mentioned, that 565 districts are less than 5%. So large part of India is the second wave is over. However, these districts are important, and it is possible for us to avert a big third wave, provided individuals and societal behaviors, protective behaviors are adhered to. We avoid mass gatherings, correct and consistent use of the mask, vaccination of the priority groups, any indicative hotspots that we find, they need to be immediately identified, and that is what we have done with the Delta plus. Immediately identified whether they are hotspots, whether that virus is going to be significant or not, we do not know yet. But we have identified where it has just suddenly emerged and isolated those people, and ring vaccination has been initiated in those areas. And the most important is that the district level test positivity rate, which is posted on the Ministry of Health website, needs to be clearly monitored by the districts to ensure if it is going beyond above 5%, then we need to impose strict restriction, and that is the most important point, and that will help us guide us through this pandemic. Thank you so much.
Thank you, sir. So we start with 15.
Sir, my first question is related to the vaccines for children and pregnant females. Sir, when it is expected that we can get vaccines for children and pregnant ladies, as well as another question is that there are two deaths which has been reported from Madhya Pradesh. It is related to those this particular variant, that is the mutant one, Delta Plus. And these particular cases are related to those who have already taken 2 doses or they have not taken doses.
Answer the pregnancy question. Yes. So, okay, go ahead. Up kar lijiye. Yeah, okay. So in terms of pregnancy, the Ministry of Health has given this guideline that they can be given, the vaccine can be given. We have also demonstrated from the ICMR, from the Preg COVID registry, that vaccination is useful in pregnant and it should be given. In terms of children, that is still a debatable question, and there is only one country in the world which is giving vaccination to children at the moment.